In terms of what we've achieved over the last year or so, we've had a great success in cancer. We've won the All Parliamentary Award for improving first year survival in cancer. We've saved £1.2 million over the last 2 years in heart failure, which is great in terms of reducing admissions. In terms of stroke, we've seen a reduction in stroke, and we've been recognised by Public Health England in terms of our stroke work. And in terms of Thames Valley, we've had some great outcomes in terms of our diabetes. And overall, what we want to do is to help people live better for longer.
We set up the Marlow and Tame hub pilots in April 2017, and this was after extensive discussions with the community. And the idea was to provide the right services at the right time closer to patients' home. The services we are providing out of there is frailty assessment service and rapid assessment, multidisciplinary assessment, particularly for frail older people. The hubs are backed up by the telephone access to geriatricians, which supports our primary care colleague and healthcare professionals in the community. We have seen a big uptake both in clinic patients and in frailty assessment, rapid assessment patients. I'm very delighted about is that there is consensus. We have got our commissioners, our primary care colleague, we have got our ambulance service colleagues. Everybody is very keen on this service. It's the direction of travel. The number of primary care referred patients to A&E has actually declined in the last few months.
As district nurses, we care for patients in their own homes, so that could be their own home or residential setting. We look after approximately about 800 patients a day throughout Buckinghamshire, and we have just under 400 staff. Our fundamental priority is making sure that our patients receive safe, compassionate care every time, every visit. The majority of our patients are elderly, but actually our age groups range from 16 to 111, I think, is our oldest patient in Buckinghamshire. I have been a district nurse for over 25 years, and increasingly our patients are becoming more complex and more dependent in terms of their medical and social need. We have an ageing population, our patients are living longer, hospital stay has been reduced quite dramatically, so therefore we're caring for these patients in the community.
I think that the GP streaming is working really well, not obviously just because of me, but because of all the GPs that are working there and the staff that are working there, the streaming nurses, the receptionists. I think the patients seem to be very, very happy with it. I think we're managing the patients very well and relatively quickly.
But the bonus of the whole thing is that the patients are actually being seen in the right place by the right people.
Certainly having the new RAT area made a big difference.
Tina, as the discharge coordinator, knows everything about all the patients, and she can be a point of contact for anyone else, like other
for any other departments, and also for the relatives, which I think is really sometimes what we lose sight of in the sense of communication. I mean, we're all busy, but it's so important, you know, patients and relatives can actually put up with quite a lot, I find, as long as you communicate with them.
Just thinking of one elderly gentleman and actually being able to work with different specialities to keep him at home, such as talking to the ambulatory care, talking to MUDAS over in Wickham, talking to the REACT team in the hospital, and actually just knowing all these people that you can call on and have help from and support from actually made it work really well, so he could go home and could be managed at home rather than having to come in and leave his home and leave his family.
The second cath lab was opened in November 2017, and it was opened because we were hoping to increase our capacity and introduce new services into Wickham cardiology departments. We've seen lots of benefits of having the second cath lab where we don't have to cancel patients because of emergency situations. We've increased our services, we can do specialist pacing devices and also some research pacing devices, which we're now doing. And so generally our waiting lists have reduced and we're able to do more services.
I was referred by the doctor, got an appointment within 10 days at Stoke Mandeville, and for the CT scan on my heart, and then exactly 2 weeks later I'm here with 3 stents.
There are a lot of things we've done at the Trust that has improved the safety of our services for our patients. We've got a team of medical examiners now, and this new introduction means that these doctors, they phone families who are recently bereaved. These medical examiners review those deaths to make sure that there was nothing that we couldn't have done better for that patient. It's really joining together families and our services to make things better in the future.
We have developed very close links between the primary care teams and the community nurses who work to support the primary care teams to deliver care to patients with type 2 diabetes. It's taken us 3-4 years to get to the point where we're at, so this is not an easy thing to achieve, but I absolutely think that what we're doing benefits patients because the professionals are all talking, linked together and sharing the same record, and the patient can only benefit from that.
It's important that we provide really good care. We've recognised that actually there's within the BME population, people with dementia are diagnosed a lot later or not at all, and there's a real inequality gap with this group of patients. With this in mind, we had a project last year which was a collaboration with Oxford Health, Buckinghamshire Healthcare Trust, with the local authority and with Alzheimer's Society, as well as other people, in order to create a project called My Life, My Memories, where we looked at raising awareness within this community in order that they do not fear the diagnosis of dementia and know how to get support.
We're recruiting across the UK, the EU and broadly across the world. There's a really fantastic leadership programme engaging clinicians and all of our leaders across the organisation to take this trust forward to make it a great place to work. We are really committed to developing colleagues' careers here at BHT. We provide lots of formal education with local education partners such as Bucks College Group, Bucks New University and the University of Bedfordshire. We also have invested significantly in apprenticeships, particularly over the last year. We're really proud about how we look after the health and well-being of our colleagues across BHT, and we remain in the top 20% of trusts nationally.
Research enables us to give patients opportunities to get involved in improving healthcare and how we deliver it through drug trials or questionnaires.
About 4 years ago I was diagnosed with stage 4 prostate cancer, and I started to receive the normal treatment, hormone treatment, which people with my condition receive at that point. And then some weeks later I was asked if I would consider taking part in a clinical trial. And that started me on the journey and the involvement with clinical trials.
The league table was published last autumn. The trust was 19th out of 440 trusts, which is quite remarkable.
All along the line, the support was wonderful. Everybody sort of cared for me and cared about me.
Very efficient. I had a CT scan 2 weeks ago, and within 2 days I had the letter to come here. Very efficient, I think.
Certainly given me an extension to my life and also the quality of my life.
That's the first time I really had somebody listen to what I had to say. Even sometimes halfway through I forget the words. They just fall into a hole and I have to wait for them to come back up.
Oh, the staff here are absolutely amazing. I really can't praise them enough.